Well, hello everyone, and welcome to the Mind, Music, and Movement Foundation's free webinar on fall prevention. I am Beth Elgort and the founder of our foundation, and I'm excited that you're joining us today. For those of you who do not know about our foundation, it was my vision to bring together this program that will help people with any neurodegenerative disease learn and gain insight into their disease and find programming that will help delay these diseases in a holistic, natural way and have camaraderie and friendship while keeping their bodies fluid. We offer different types of programming such as yoga, functional training, art, dance, and hopefully a lot more programming along the way as we build our foundation. Tonight, you will learn a lot through our lovely young lady, Savannah, who I've worked with already, and she's a joy. And I hope you will give her a chance to ask questions and have fun with tonight. And I'm going to turn it over and enjoy yourselves. Savannah, take
Good
it.
evening, everyone. Can everyone hear me okay? Maybe throw a thumbs up if you can. Wonderful. I love it. It's so nice to see all of your, oops, I'm already flipping the screen here. It's so nice to see all of your beautiful faces here this evening. For a brief introduction, my name is Savannah. I work for Physical Therapy and Balance Centers. We specialize in gait, balance, and vestibular therapy, but we do physical and occupational therapy for just about anything and everything that you need. And so that's a little bit about who we are, but it's more important, what do we do and what's the purpose of us teaming up together? And this is why I think Beth and I and our community partnership works so well and so fluid together, is because we are on a mission to prevent. And with that being said, September is Fall Prevention Awareness Month. So we have a huge campaign this month called Fight the Fall. So it pretty much works perfectly that this ends up being all about fall prevention. And so ultimately, we're looking to empower you with the knowledge, the exercises, the expertise, the tools to prevent falls from ever happening in the first place. And so, this goes hand in hand. And switching the mindset overall, just from being in a mindset of using physical therapy, using your physician offices from sick care into well care. We really want this wellness aspect, this holistic aspect of trying to prevent things from ever happening in the first place. And so what we're going to start with today is just some facts so you feel grounded and informed with the information that we have available to you. And then we're going to talk a little bit about fall prevention tips and tricks. And so maybe you've never had a fall before, but I think it's safe to say that each one of us have had an experience, whether it be with a family member, whether it be with anyone that you love, a friend, or a story that you've heard about someone having a fall and then, something happening because of it. So that's exactly what we're going to talk about today. Welcome. So excited to have you all here. And so starting off with the facts, every second of the day an older adult suffers from a fall, which we don't like to hear that, but that's the statistic there that we're working with. And then 1 out of every 5 falls actually results in a serious injury. And so a question I would like to leave the floor open for would be, what do you think is a potential injury that we see a lot for falls? So we can kind of think about that for a second, but I'll give you the top 3 injuries that we see, at least in the clinic, from falls. And so number 1 would be hip fractures, right? So you hear a lot about someone having a fall and then unfortunately having a hip fracture. Another one is TBIs, concussions, and the third would be the wrist fracture, right? So these are all 3 things that happen quite frequently with falls. And so when we talk about hip fractures, actually 95% of them are a result from a fall. I mean, 95%, it's an astounding number. But the good part about it, and the part that we really want to hone in on today, is that 95% of hip fractures then are preventable. And that's huge. That means so much to us, because that means that these things don't have to happen in the first place if we have the right tools in our toolbox in order to know how to prevent falls from ever happening. And actually, when Beth and I were talking about this before we even had this presentation, we were kind of going back and forth a little bit about, how your balance declines. And we both were sharing stories about how my grandmother had passed away from a hip fracture from a fall. Beth had an experience as well. And so I think we can all kind of think of that certain someone that we're like, oh no, that shouldn't have happened, and things can be prevented. And that's exactly why we're here, and that's exactly why we're doing this. So actually at the age of 30 is when our balance declines. So it doesn't matter whether you're 30 or whether you're 65, it doesn't make a difference. So think of your balance as a hill, right? So it goes up, 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 our balance is really great. And then if we don't work on it, and we don't do things to prevent falls, it starts going woo down the hill. And so what we want to do is go up, and then we want to stay riding at the top of the hill there. And just talking to that, I think everyone has the mindset of, this is never going to happen to me. And that's exactly the mindset that we want you to have. We don't want you to think that this is going to happen to you, but overall, we're empowering you with this knowledge to be able to exactly do that, prevent this from happening. And so if you want to take notes for today, you can grab your pen, your paper, and notebook. We're going to get down to business. We're going to talk a little bit more about statistics and things that you can do on your own, or maybe something that you can share with someone else, right? Knowledge is power. So we're not just treating falls. We want to teach you exactly what the basis is behind it. And so actually back in 2011, studies show that 2.4 million Americans were treated in an emergency room because of a fall. 2.4 million people. I mean, it's just astounding. It's insane to think how many people are dealing with this. And we think it's small numbers, but it's not. And so falls are often due to hazards that are easy to overlook, but also are easy to fix, right? So we think of, when's the last time you possibly tripped over something? When I think about it, it was probably yesterday morning when I had my mask on and I was walking outside of my house, and I looked down and didn't look down all the way, probably was trying to press it against my face to see the curb, and I tripped over the curb. And this is just the little stuff that you don't even think about, and you're just so used to doing your day-to-day activities, and then bam, you get caught or stuck, or something along those lines. And so that's why we're doing this, is to make sure that you're creating a home environment that is conducive to not having these little silly things happen to you. Another huge one is you think of the corner of your rug, right? When your rug starts to turn up in the corner, you're like, no, I love that rug, but you got to flip it over on the other side, or find a little sticky to stick the side down, because that's just the one little thing that might catch you on the back end. And so the first part of your house that we're going to talk about today is floors. So I know it's the easiest place to put everything down on, but you want to take a look at the floor in each one of your rooms. And, if you're not able to do this, you can always ask a family member to help you, a friend, but just to have clear paths in each one of the rooms in your home. And so a question that we would possibly ask one of our patients is, when you walk through your home, do you have to walk around furniture in order to get to somewhere in your house? So asking someone to move the furniture so your path is clear. Do you have throw rugs on your floor? Are there papers, books, magazines, towels that are objects on the floor that you could potentially trip over that you're not thinking about? Oh, I'll put it away later, especially the laundry. I know that I'm bad at that one. So just making sure that you're removing it from an area that you can trip from on the floor. And then finally, do you have to walk around cords, wires, extensions, like your lamp, your telephone, or your extension cord? So those are all huge things that you think, well, yeah, it's fine, it's behind the couch, or it's underneath, or, oh, I'm not going to trip over it. But just coil or tape it so you don't have to worry about it. So next we're going to talk about stairs and steps. And so with stairs and steps, if you don't have them in your house, then hey, you're good to go here. But if you do, look at the stairs you use both in and outside of your home. Maybe you can ask yourself, are there papers, shoes, books, or objects that are potentially in your way? Are there some steps that are broken or uneven? That's a big one. Are you missing a light over the stairway? Do you only have one light switch for your stairs? So maybe it's late at night and you've got to walk down to the stairs, but there's only a light switch at the bottom of the staircase. Well, that could be something that you could potentially work with. And then are the handrails loose or broken, or is there only one handrail on the side of the staircase? And so moving on to your kitchen. Look at your kitchen, check out your eating area. Are there things you often use that are on super high shelves and you probably have to be like me and just like jump up towards the top or stand on your tiptoes, little things like that? And then if so, if you have to get up to a high area, is your step stool unsteady? So making sure you've got something obviously that's grounded into the floor so you don't have to worry about that. And then next, when we're talking about bathrooms in the house, just looking at all of your bathrooms, making sure that the tub or the shower floor is not slippery, use a non-slip mat. And then if you need support, using guardrails to be able to get up or down, things of that nature. And so the last part of the house that I want to talk about is just your bedroom. And so just checking out your bedrooms and making sure that the light next to your bed is just easy to reach. And placing a lamp, if not just a little night light on your path to go to the restroom in the middle of the night. You wouldn't even guess how many times we hear patients say that they come in and, well, they tripped in the middle of the night because they thought they'd be fine. And they know where the bathroom is, but you just don't expect for that little stuff to happen when it's dark. But when it's dark, our vision is compromised, and we've got to think about these things and make sure that it's safe for us. And so moving on to what else do we know? So falls are actually the leading cause of fatal and non-fatal injuries to us in the United States. And so let's get into a little bit more about what is balance. Balance is a catch-all term. It's used in a lot of different ways, right? So someone says that they're off balance, that could mean that they're dizzy. It could mean that they're weak or they feel unsteady. So balance is a term that is oftentimes we don't really understand what exactly it means. And so as the vestibular and balance experts, we're going to tell you exactly what it means. And so there are actually three main causes of dizziness or imbalance. And so these three main causes are the muscular weakness, so your musculoskeletal system, as in having weakness in the legs. Number two would be your vestibular system. So that's all talking about the inner workings of your ear. So there are these three semicircular canals in your ear that are helping with your hearing. And so how you hear is your proprioception and how you know where you are in space. And if you have a loss of hearing and you don't use hearing aids or things to be able to help you, then that could potentially throw off your balance as well. And then the third component of your balance system is your vision. So all three of these things, think of it as a giant wheel working together. So these three components, and let's face it, not every person has the same issue with their balance. Balance is not a cookie cutter term that when we see a patient that it's always going to be the same. No, in fact, every single person is different. And so you could have an issue in more than one area. It doesn't just have to be muscular weakness. It could be a combination between having that weakness and then a little bit of lack of your visual component. And so that's why we really hone in on all three of these systems in order to make them work cohesively. And if there's a lag in one area, then we can hone in on that, focus on that, and then allow for your balance to be that full spectrum once again. Let's actually stop here for a second, just in case anyone has any questions so far or any comments. We're good? Great, wonderful. Question of the day, what can you do right now in order to help your balance? Well, folks, I'm going to tell you what you can do right now because we're going to have a little fun together. So we're going to take it into movement. I'm sure we've all heard the phrase before, but motion is lotion. Motion keeps your boat afloat. It keeps you thriving. It keeps you loving your life. And that's our motto at Fyzical. And so these are just a couple of things. And maybe you even want to write a couple down or take a picture, but these are all fairly easy tasks, considering if you're able to do a sit to stand, that you can work on to help with your balance. And so it's not rocket science. It's just a couple of tools to be able to use and take with you away from today that you'll be able to help with your balance. And so the first one is a sit to stand. And so I'm going to demonstrate, but obviously it's on the screen here, in which you're just sitting from your chair and then standing up from the chair and then sitting back down. Perfect. Love it, Gail. So yeah, so when you're doing that sit to stand here, you're going to notice for some of us, we may need to use our hands to press away from the chair, and that's okay. But our ultimate goal is you want to have the strength in the legs to not have to use the hands to go ahead and do that sit to stand without any hesitation or issue at all. And so that's how you're really creating that strength and stability in your lower legs. The next one we're going to talk about is a toe tap. So a toe tap is, think about literally tapping your toes. So like lifting the tops of your feet and tapping them to the ground. So if you do that, you can go and literally go and touch the front of your calf there. You're going to feel a muscle fire up there. It's called your anterior tibialis. Tongue twister there, but essentially what that does, it's lifting the front of your feet and it's helping with your gait and your balance. And that's an easy one that you can do, hey, on your favorite show, in your commercial break, wherever you want to do it for a minute. And I'll tell you, your legs are going to start to tire out a little bit, but it's a great and an easy one that essentially anyone can do. And then the next one we're going to talk about is a little bit more of an advanced exercise, but it's a single leg balance. And so with anything that you're doing balance related, you have to be obviously in a safe area of your home. And so I'm sitting at my desk right now, but if I were in my home, a great place to do this would be in the corner of my room. So essentially what I would do is just get up, go to the corner where I have two places where I can place my hands on the wall and then lift one of the feet. And so when you're lifting one of the feet up, not only are you working your hip flexors because you're lifting your leg, but you're practicing your balance. And then maybe so when you're doing that, you come to the point where you feel really confident that you only have to use one hand. And then maybe you get to the point where you don't have to use either hands and you're able to do this single leg stance. And so realistically, we should be able to do this, and the way that we would use it in the clinic is you should be able to do this for 30 seconds without an issue. And that's how we kind of see that. If you're kind of struggling below that 30-second mark, that's where we know we have some stuff to work on with you. And it's a good thing, right? Because if we don't know what's wrong, hey, if you don't know what's broke, you can't fix it. So it's good to be able to practice these things on your own. And so the next one we're going to talk about is a head rotation. So it's exactly as it sounds, right? Turning your head to the right, bringing it to center, and then turning it over to the left. And using your eye gaze with it. And so that's challenging, not only your balance system, but that's specifically, what do you think it's working on? It's working on our visual component to our balance. So we're so used to having our eyes in order to see where we're going. But when you remove that visual component to your balance, that's where you're really testing your muscles and really firing up those stabilizers in your legs in order to work on that. And so let's move forward on to marching. And so marching is the same. You can do it in the corner of your room, or if you have the confidence to where you don't need a hand or two on the wall, it's literally just lifting the knees and stepping them down to the ground. So literally like you're marching in a marching band. Awesome. So the last thing we're going to talk about is stretching. And so when we talk about movement, it's not just lifting up a bunch of heavy weights. It's a combination between wanting your cardiovascular system working, wanting that concentric motion, so wanting that strengthening, but as well as eccentric, so lengthening. So we want that strength, but we also want that flexibility because it works hand in hand for your entire musculoskeletal system or your entire body. So we're going to do a little stretching today just because it feels good. So why not, right? Like let's live it up. So the first thing we're going to do today actually is we're going to start with our neck. So what I want you to do is just take your chin over towards your right shoulder. You're going to take your right arm up, take it to the base of your skull here, and just gently press your chin in towards your chest. So relax your right shoulder, And you're gonna feel a nice little stretch at the left side of the neck. So from your neck all the way down to your shoulder. Beautiful job, everybody. Love it, love it. Just take a few deep breaths here. Just relax your body. Nice. Take one more deep breath here. And then you're gonna release that. Lift your head back up to center. Slowly take it over to the left side. Bring your chin into your body. Take your left hand to the base of your skull. Bring your chin in. Relax your shoulder. And just linking your breath with the way that you move. It's just as important as creating this movement. Nice. So you're going to release your head, bring your left hand down. We're just going to rock the head from shoulder to shoulder. So now we're not making a full rotation with the neck because that compresses your spinal cord, your cervical spine. So it's just a half rotation here from shoulder to shoulder. Nice. Now bring your head back to center. We're gonna do some shoulder rolls. So bring your shoulders up towards your face, squeeze, create some tension, and then draw them down. Nice. So just like you're coming into a turtle shell. And then we're gonna take it the opposite way. So bring them forward. Nice. Now we're gonna bring the hands onto the shoulders. So like you're putting on shoulder pads here, and then make nice big rotations with your elbows. Try to bring them together. My shirt is too tight at the sides. And bring it around town. Nice. So as close as you can get your elbows together. So we're working into the rotator cuff, that shoulder area there. And also the point of this being is that your body is entirely interconnected. So an issue that you have in one place could be causing an issue in another place. And so in PT, that's what we're looking at too. We look at the joint above and below the one that we're working on. Nice. Take it the opposite way. And release that. Take your left arm over your body. Take a little tricep stretch. Catch it. Pull it in. You can rock it a little bit like you're rocking a baby. Take it the other way, opposite arm over your body. We're just literally working from our head to our feet. I love this stuff. Feels so good. Awesome. And now if you can, you're just going to stand up out of your chair. We're going to do some trunk rotations. So literally just go from side to side just like this. If you feel a little crack in your back, that probably feels good. So keep it going there. Nice. Now you're going to come back to center. I'm going to step back a little bit, but you're going to inhale, lift your arms up nice and high, and then exhale, fold forward into your body. Take your time here. If you can touch the ground, or if you can't, bend your knees a little bit. Relax your head, hang 10. Perfect. Roll up through your back. Take your hands to your hips here. Perfect. Separate your feet just about hip width apart. And then fire up your booty. You're going to send your hips forward, bring your shoulders back, just a little baby back bend. Nice. Release that. Have a seat back where you are. We're going to take it to the lower leg. So your left knee is going to be up with your foot flat, so just like you're sitting, and then straighten out your right leg so your heel is on the ground and your toes are up. Just like that, dorsiflexion, like a dolphin fin. And then you're going to lift your arms up, lengthen out your spine, and then fold over your legs. So take your head down towards your leg wherever it can go. Nice. And come on back up, switch your legs, straighten out your left one, flex your foot, toes facing up, lift your arms up, lengthen it out, hinge from your hips, fold over your left leg. If you want, you can take your hand to your leg, massage your leg, give yourself some love. It feels good, why not? Do it. Good stuff. Perfect. Now bring both of your knees up, your feet go flat, and we're gonna finish off. Rotate your wrists, Take care of your hands and your feet that take you to amazing places with amazing people. Rotate your ankles however you can. You can shake them out, roll them out. Now interlace your fingers so you're making a figure 8. Roll out your wrists. Perfect. Last one, we're going to do a little wrist stretch. So hand faces here. Take your hand on top of the opposite and just gently press your fingers back. Nice. Release. Do the same thing with your thumb. Press it back. Opposite hand. Take it to your fingers. Press them down. And take it to your thumb. Press it down. There we go. So now not only do we work on our balance day, we did a little flexibility work too, and that's what it's all about. We got some awesome circulation flowing in your body. That's the whole goal of it. Keep your body moving. It feels good. It keeps you agile, young, feeling amazing. So we're gonna move forward. Talking about how falls do not need to be a part of the normal aging process. Falls are, they're not normal. They don't need to happen. If they do, we can prevent them from happening again. But the whole point is that if someone says, oh, well, I fall all the time, it's okay. Be the friend or be the person that says, no, it's not okay. We need to help you. We need to do something about it. And that's how you're going to set yourself up for success, and you're going to help someone else. And what's more beautiful than that, right? Not only like empowering yourself with this information, but being able to share it with other people is just as valuable. And so taking it kind of to talking about what we do in the clinic. So loss of balance is like loss of strength. If you start challenging it, you get stronger. So just like your flexibility, if you're not flexible and you never stretch, well, how are you going to get more flexible? If you don't have good balance and you never practice, well, how is it going to get better? You got to work on it. Research proves that balance can be improved at any age, and we've done it in our clinics. We see it hand in hand. We see people that are 50 that are working on their balance. We see people that are 105 that are working on their balance. There's no difference. We can help at any age. There's no limit there. So as the saying goes, use it or lose it, right? And so what we do, and just overall what working on your balance does is it increases your confidence. Half of our issues with balance are just being confident enough to know that you're not going to fall, being confident enough to know that, oh, well, I don't need to use my walker today. I feel great. And just working towards reducing your risk of falling, becoming stronger, and learning how to prevent a fall from happening in the first place. And so what we're doing in our 9 centers in Palm Beach County right now is we offer in-clinic physical therapy. We offer therapy in the home. So it's not home health, it's different because we're sending the physical therapist. We're doing all the work. We're either working outside, working in your pool, wherever you want to be, but we're doing the same things as we would do in the clinic, except we're bringing all of that stuff and then bringing it to your home. So you have that same program. It's just, of course, with everything happening with COVID right now, we want to make sure that we're giving everyone the opportunity to get well, even if you don't necessarily want to be in an outpatient facility. And then finally, telemedicine. And so just to talk about what we do in the clinic to help with balance is we have what is called a safety overhead support system. And so what this does is commonly in a physical therapy setting for any type of neurodegenerative disorder, balance dysfunction, we want to be working obviously on your stability and your balance. And so we have a harness system so you can practice your balance activities without actually having the fear of falling. And if you do, you are strapped in so you don't hit the ground and it's fine. Traditionally in physical therapy, before this kind of technology came out, is therapists would walk around, and I'm sure you've all seen it at some point before, but we use a gait belt around you. So you have this thick belt around your waist and someone is walking behind you with the belt. But what's the problem here? Well, the problem is that it doesn't simulate real life. We don't have someone walking around with us holding us at our waistline to make sure that we don't fall. And that's not what we want in life. No one wants someone walking around making sure, oh, well, don't fall, don't fall, don't fall. It's like, no, I just want to feel balanced. I want to feel good. I don't have to worry about it in the first place. And then just to talk to a little bit more on the tech side, we use what is called a computerized dynamic postureography. And this is more so just to let you guys know what is available out there for everyone to be able to use for their balance. And so what this does is it simulates virtual reality to determine what exactly is the percentage of lack of your balance issue. So it could be, again, like we talked about, that visual component, the hearing component, the musculoskeletal, the combination of the three. So it just gives us a way as physical therapists to actually find that information at a granular level and to be able to quantify it and then to be able to provide it for you, rather than just saying, well, we think it's this. Now we can say we know it is this. So things are on the up and coming. So finally, we're going to talk about tips for improved safety in your home. And we've talked about a couple of these things earlier, but just to kind of go over it in the grand finale here, improving the lighting in your home. Can't stress this enough, but if you can't see in any area of your home in the middle of the night, add a nightlight, add a lamp. There's plenty of cute ones at TJ Maxx, we all know. But just brighten up the lights in your home. It's so helpful to be able to see objects on the floor. If you didn't remember to put something away, you've got your vision, you're good to go. So that's a very important one. And then moving on to what we just said, removing things that you can possibly trip over. So just cleaning any area that you're constantly walking in, so you don't have to worry about that, your stairs, etc. And so next we talk about getting an eye checkup. So I know it's kind of funky. You're thinking, well, why are we telling you to go visit the eye doctor? But hey, we're healthcare providers. We all work, or at least we want to. We all want to work hand in hand. And so that's exactly why we're here. We want you to make sure that you're being able to see well and to have an annual eye check, to update your glasses, because you never know. What if potentially your vision has changed in the past year? Things change all the time. So making sure that your prescription is up to date, whether you have bifocals, regular glasses, and also if you have bifocals, understanding how to use them. One of my colleagues actually has bifocals, and she said when she first got them, no one ever told her how to use them. So she's like, what is this? I'm looking up, I'm looking down, I have no idea what's happening here. And they were just given to me, and here I am on my way. I have no idea how to use them. So just making sure you do know how to use them. And if you don't, just ask. There's no harm in asking. Fall prevention tip, we did it earlier today, so you can say you got in your little bit of exercise today. 30 minutes a day is recommended, but begin an exercise program to improve your leg strength and balance. Anything that you love. It doesn't have to be me telling you to do your marching. It can be just anything that you love, that you feel like you are thriving with doing. If it's getting up and turning on your record player and having a dance, if it is going to yoga, and especially the amazing online yoga classes that Beth has talked about, I'm going to have to hop in one because I'm really excited about it. And it's just anything. If you enjoy riding your bike, taking a walk, swimming in the pool, that's a great one because it is really great for those arthritic conditions as well. These are all great things. There's no one that's better than the other. It's just whatever you're passionate about and what you love to do as far as exercise. We're going to talk next about reviewing medications. So one of the problems, I'll put in quotations, problems that we have with our healthcare system right now is that you have to see a lot of different doctors for a bunch of different things. It's not just, you don't just go to your internal medicine physician anymore. You go to your neurologist, you go to the internal medicine doctor, you go to the rheumatologist, you go to the cardiologist. I mean, all of the ologists, you're seeing a lot of different people. Even for me, everybody's got a bunch of different people that they are going to see. So our goal here is your pharmacist is your best tool. They have a wealth of information that I didn't even know until I did the research myself. Holy moly, they've got every tool in their toolbox in order to help you with reviewing your medications. So if you ever have a question about, is this counteracting or what is this doing, ask your pharmacist, because they've got all those tools in their tool belt to help you, and it's underrated, to say the least. And so that's it for our main 5 fall facts and tips here, and that's me down there on our website. But thank you so much for letting me share this information with you. We're definitely going to unmute, so I'd love to just hear if anyone has any comments, any questions, or even just like a story that they want to share that might inspire someone else, or something that, you know, they've kind of gotten from it, I'd love to hear. So thank you again so much. Oh, and actually, let me just mention is that if you or anyone you know is had a fall and they're being treated for like a hip fracture or an injury from a fall, make sure that you're not just being treated for the injury that you have. You have to be treated for the fall, the reason that it happened in the first place. And so I can't stress that enough. You're not just being treated for the injury. You have to be treated for what led you there in the first place. So thank you.